Hi Manoj.
Hi,
Morning.
Shaju. Morning.
So how's your day today?
Okay, sir. Today is a good day.
So any patient you saw today?
Yes, sir. I saw a patient today. His name is Mr. Kumar.
Good.
He's 25 years old, and I've done my history taking and my dental charting as well.
So you want to summarize your findings for me?
Yeah, sure, sir. So Mr. Kumar came in today just for a general checkup. He actually visited a dentist 6 months ago for just a scaling and polishing. And I've asked him a little bit more questions regarding his history before proceeding to the extraoral examinations and intraoral. So for his medical history, he has no significant, no high blood pressure, no high cholesterol. For his family history, his father is diabetic, but it's under control. His mother is healthy, and his sister is insulin-dependent diabetic. So
So there's a diabetic history.
Yeah, diabetic history. Yeah. So for his social history, he is currently a smoker. He smokes 1 pack of cigarettes a day for 1 year, and he's been smoking for 5 years actually. So he has some sort of tendency to wanting to stop smoking, but he has not tried it yet. But he said that he will try it, and he does not drink any alcohol. Alright. So for his dental history, he brushes 1 time a day. He doesn't use mouthwash and he doesn't floss, and he visited a dentist 6 months ago for just scaling, like I mentioned. His diet is, he's a vegetarian. He doesn't eat much sweet food, and he drinks coffee occasionally and snacks occasionally. Yeah. So that's it for the history. For the extraoral examination, there was nothing significant except for it was a mobile, but it was not tender, palpable lymph node.
Okay.
Right. Yeah.
On the
Left side.
Left side.
Left side. Okay. So then I proceeded to the intraoral examination. For the intraoral examination, all teeth are present, but the molars, especially on the 3-8, is partially erupted. Only the partial part of the crown can be seen. Upon probing, there was bleeding on probing on the lingual anterior and as well on the 3-7. Okay. When I checked for the pocket depth, there was a 5 mm pocket depth on the distal aspect of 3-7. 3-7, yeah. Okay. So I did the BPE as well. Okay. For the BPE, the first sexton had a score of 0, and the second sexton 0, and the third sexton 1, and the fourth sexton 3, fifth sexton 2, sixth sexton 1.
Okay.
Yeah. Okay. And also to mention that all the posterior molars, especially on the occlusal aspect, have stain, but they are not soft.
Okay.
Yeah. So I think that's it for the intraoral dental charting. Yeah. So we proceeded to take a bite wing,
Routine bite.
routine bite wing. Yep. And we have found out a few significant findings. So firstly, I will talk about the 3-7. We found a radiolucency closely approximating the pulp, the rigidentine, and yeah, that was one of our findings. And for but we cannot appreciate the periapical because we took a bite wing, so we cannot see the periapical. But for the 3-8, it's horizontally impacted, okay, and there was bone loss on the 3-8 as well.
Whole of 3-8 or a part of 3-8?
Only on the crown aspect of the 3-8, yeah.
Okay,
There was bone loss, yeah.
Okay.
So that's it for the radiograph. Yeah.
So your diagnosis is going to be?
So like I said, for the 3-7, I cannot come with a final diagnosis, but my initial diagnosis will be proximal dental caries on the distal aspect. Okay, and but I need to perform the pulp sensibility test to get a final diagnosis. And for the 3-8, I would give a diagnosis of chronic localized severe periodontitis.
Okay. We'll focus on 3-7 now.
Okay, 3-7.
So you have a provincial diagnosis of dental caries,
Dental
on the
caries.
proximal aspect.
Yes, yeah.
Do you have any differential diagnosis?
I will give a few differential diagnoses, such as reversible pulpitis and irreversible pulpitis. But however, the patient did not come with any complaint of pain or sensitivity to cold and hot.
Okay.
Yeah. So most likely we can rule out reversible and irreversible pulpitis. But perhaps when we are performing the pulp sensibility test, the results may vary.
Okay.
Yeah. So then we can come up with a final diagnosis. Yeah.
Okay. Apart from that, how did you rule out that there is no apical involvement?
Okay, I performed the palpation and percussion test. For percussion test, it was not tender, and for palpation, we did not feel anything, and it was not mobile.
Okay.
Yeah, so we can say that there was no periapical involvement, but it would be better to take a periapical X-ray.
Periapical X-ray.
Yeah,
Okay.
just to be.
So your priority in diagnosis would be, the first priority as a diagnosis you'll be giving it is?
Do you mean for the 3-7?
3-7, yeah.
Yeah, dental caries.
Dental caries.
Dental caries.
Followed by
proximal
reversible or irreversible
Irreversible
pulpitis.
yeah.
Okay. What do you expect in your pulps testing to be seen?
Okay, so for reversible pulpitis, for the heat test, the patient, it could be normal or it could be exaggerated. Similarly for the cold test as well, it could be normal or exaggerated. And for the electric pulp test, the patient would, for reversible pulpitis, would jump, or would feel the pulp test, the electricity at a lower value. Yeah.
Oh, okay.
So and the pain will be just it won't be lingering, just be a short pain and it will go off. Yeah. For irreversible pulpitis, on the other hand, the pain will be quite severe on cold. Yeah, and also for the EPT, for the electric pulp test, the pain will be lingering.
Okay.
Yeah.
So I also feel that your first diagnosis might be more appropriate. Your dental caries without any pulp involvement.
Yes. Yeah.
Okay. So if it is so, how are we going to manage this patient?
All right. There are a few things that can be taken into consideration for the factors in giving our treatment. First of all, there is a horizontal impaction of the tree 8.
Good.
So most likely we may need to perform a minor oral surgery to remove the tree 8, as it is one of the local factors causing the dental caries.
Very good.
Yeah, and then after we have removed that, we can do after we come out with the pulp sensibility test, we can figure out whether it's reversible or irreversible pulpitis. But seeing that the lesion has progressed quite a lot in the dentine as well, most probably we have to do a deep caries management.
Very good.
Yeah, for the 3-7. Yeah, unfortunately, if the tooth is leading towards irreversible pulpitis, or it is perhaps when we are excavating the caries and it has reached the pulp, then we might have to proceed to RCT, root canal treatment.
Is RCT an unfortunate treatment for the patient?
It's not an unfortunate treatment, but I guess it will incur more cost for the patient, as he will need a crown later on. Yeah.
Yeah, it's how you look into it, right?
Yeah.
You can still save the
Still save
tooth
tooth,
if it
yeah.
is,
Okay, yeah.
there. Okay. So, what do you think you want to know more about this scenario? What do you think you want to go through in your learning part? What more you want to know?
Okay.
So that we can form a plan for you to have a self-directed learning.
Okay. I would like to ask the patient whether he's agreeable with the treatment as well.
Yeah.
Because he needs to understand what we are going to perform as well. Yeah.
That is not the aspect I asked you.
Okay.
To improve your learning
Mm-hmm.
with this clinical scenario which you had in mind.
Okay.
What more reading do you think would help you to manage this patient or identify the causes or diagnosis to help you learn better?
Okay. Perhaps during my clinical examination,
Huh.
I could have performed it better to find the proximal caries.
Okay.
Yeah, and without the help of a radiograph, because it was an accidental finding.
Okay, very good.
Yeah, so
you want to know about various clinical examinations which can help you in identifying
Yes, yeah,
caries.
caries, yeah.
Very good.
So that would be one of it.
Very good.
And also to know more regarding periodontitis,
Okay.
because 3-8 is actually has bone loss and it is under chronic localized severe periodontitis.
Okay.
So I would like to know a lot more about chronic periodontitis and aggressive periodontitis
Okay, very good.
and the differences. Yeah.
Okay, Manoj, that was a very decent, good presentation.
Okay, thank you, sir.
Thank you.
Okay.